Dear students, in this lecture we are going to continue talking about general considerations in toxicology, and this is part 2 of the first lecture. At the beginning, we are going to demonstrate the objectives of this lecture. In this lecture, we are going to determine spectrum of undesired effects and to discuss two examples of adverse reactions. These are the allergic and idiosyncratic reactions. In this lecture, we are also going to explain reversible versus irreversible toxic effects and local versus systemic toxic effects. Other objectives are to determine the characteristics of exposure, to identify routes and sites of exposure, and to categorize the duration of exposure in human exposure situations and in experimental animal exposure. At the end of this lecture, we are going to explain the relationship between elimination rate and the frequency of exposure and its impact on the toxic effect. The first topic that we are going to explain is the spectrum of undesired effects. We have three terms and we need to know the meaning of each one. These are the therapeutic effect, side effect, and adverse effect. In therapeutics, each drug produces a number of effects, but usually only one effect is associated with the primary objective of the therapy, and this is what we call a therapeutic effect. All the other effects are referred to as side effects. Some side effects of drugs are always deleterious to the well-being of humans. These are referred to as the adverse, deleterious, or toxic effects of the drug. Concerning adverse reactions, we are going to mention two examples, which are allergic and idiosyncratic reactions. First, we are going to explain allergic reactions. What is the underlying mechanism of these reactions? Chemical allergy is an immunologically mediated adverse reaction to a chemical, resulting from a previous sensitization to that chemical, or it could also result from sensitization to a structurally similar one. For example, the similarity in the structure of the R1 side chains of penicillins and cephalosporins determine the probability of the cross-reactivity between these drugs. What are the terms that are used to describe this type of reaction? The terms hypersensitivity, allergic reaction, and sensitization reaction are used to describe this situation. Once sensitization has occurred, allergic reactions may result from exposure to relatively very low doses of chemicals. Importantly, for a given allergic individual, allergic reactions are dose-related. Now, the question is, how does an immune response occur? Simply, an immune response occurs when a foreign molecule is recognized by the immune system. Most chemicals and their metabolic products are not sufficiently large to be recognized by the immune system as a foreign substance, and thus must first combine with an endogenous protein to form an antigen or immunogen. Such a molecule is called a hapten. The term hapten was taken from the Greek verb meaning to fasten or bind. Hapten is a molecule that does not elicit an immune response by itself, but it can cause an immune response when attached to a large carrier molecule such as a protein. A well-known example of hapten is urushiol, which is the toxin found in the poison ivy, which is a top cause of allergic contact dermatitis. Subsequent exposure to the chemical results in an antigen-antibody interaction. This interaction provokes the typical manifestations of an allergy that range in severity from minor skin disturbance to fatal anaphylactic shock. Another example of adverse reactions is the idiosyncratic reaction. Why some individuals experience an idiosyncratic reaction upon exposure to a certain chemical? The reason of that is genetic. By definition, chemical idiosyncrasy refers to a genetically determined abnormal reactivity to a chemical. Now we need to explain 2 points regarding an idiosyncratic reaction, and these are the type of reaction and sensitivity among individuals. The response observed is usually qualitatively similar to that observed in all individuals. That means all individuals show the same type of reaction. However, these individuals differ in their sensitivity, that some show extreme sensitivity to low doses and others may show extreme insensitivity to high doses of the chemical. As we mentioned previously, that the reason of an idiosyncratic reaction is genetic. Specific genetic polymorphisms in drug metabolizing enzymes, transporters, or receptors are responsible for many of the observed differences among individuals. An example of idiosyncratic reaction is that some individuals are abnormally sensitive to nitrites and other substances capable of oxidizing the iron in hemoglobin, whereas normal individuals would be unaffected. This produces methemoglobin, which is incapable of binding and transporting oxygen to tissues. Now we are moving to another topic, which is reversible versus irreversible toxic effects. What would be the factors that determine whether the toxic effect is reversible or irreversible? Actually, the ability of the tissue to regenerate and the way that the toxicant binds to the target would contribute to the determination whether the toxic effect is reversible or irreversible. If a chemical produces pathological injury to a tissue, the ability of that tissue to regenerate largely determines whether the effect is reversible or irreversible. For example, liver tissue has high regeneration ability, and most injuries are therefore reversible, while central nervous system injury is largely irreversible because its cells are differentiated and cannot be replaced. Carcinogenic and teratogenic effects of chemicals, once they occur, are usually considered irreversible toxic effects. Now we are going to explain local versus systemic effects. Local effects occur at the site of first contact between the biological system and the toxicant. In contrast, systemic effects require absorption and distribution of a toxicant from its entry point to a distant site at which deleterious effects are produced. Most substances, except for highly reactive materials, produce systemic effects. Some materials can produce both effects. A term that you are going to come across in toxicology is the target organ, so we need to explain the meaning of this term. Most chemicals that produce systemic toxicity usually elicit their major toxicity in only one or two organs, which are referred to as the target organs of toxicity of a particular chemical. Paradoxically, the target organ of toxicity is often not the site of the highest concentration of the chemical. So it is not always true that the target organ of toxicity has the highest concentration of the chemical. If we arrange the target organs in terms of a frequency of involvement in systemic toxicity in a descending order, the first one would be the CNS, which means that the CNS is the most frequently involved target organ in systemic toxicity, followed by the circulatory system, then the blood and hematopoietic system, followed by visceral organs such as the liver, kidney and lung, and the skin. At the end would be muscle and bone. Muscle and bone are seldom target tissues for systemic effects. Characteristics of exposure. For a chemical agent or its metabolic products to produce toxic effects in a biological system, certain points need to be achieved. The first one is that chemical agent or its metabolic products should reach appropriate sites in the body. The other points are that chemical agent or its metabolic products should reach at a concentration and or a length of time sufficient to produce a toxic manifestation. A toxic response is dependent on the chemical and physical properties of the agent, the exposure situation, how the agent is metabolized by the system, and the overall susceptibility of the biological system or subject. Routes and sites of exposure. The major routes or pathways by which toxic agents gain access to the body are the gastrointestinal tract through ingestion, lungs through inhalation, skin referred to as topical, percutaneous or dermal, and other parenteral other than intestinal canal routes. Concerning the effectiveness of route of exposure, the intravenous route is the most effective one. Toxic agents generally produce the greatest effect and the most rapid response when given directly into the bloodstream. An approximate descending order of effectiveness for the other routes would be inhalation, intraperitoneal, subcutaneous, intramuscular, intradermal, oral, and dermal. How could the route of administration influence the toxicity of agents? Let's take an example to explain that. An agent that acts on the CNS but is efficiently detoxified in the liver would be expected to be less toxic when given orally than when inhaled. The explanation of that is, in the oral route, the agent will pass through the liver, and upon detoxification, the bioavailability would decrease, and less concentration would reach to the CNS in this case. While the inhalation routes avoid the first pass effect in the liver, and in this case, more concentration reach to the CNS. Duration and the frequency of exposure. First, we are going to explain duration of exposure. At this point, we need to identify the categories in human exposure situations and also in experimental animal exposure. And also we need to know the time that each category refers to. Toxicologists usually divide the exposure of experimental animals to chemicals into 4 categories. These are acute exposure, subacute exposure, subchronic exposure, and chronic exposure. Acute exposure is defined as exposure to a chemical for less than 24 hours. Subacute exposure refers to repeated exposure to a chemical for 1 month or less, while subchronic exposure for 1 to 3 months and chronic exposure for more than 3 months. In human exposure situations, the frequency and the duration of exposure are usually not as clearly defined as in controlled animal studies, and these are acute, subchronic, and chronic exposures. Workplace or environmental exposures may be described as acute, occurring from a single incident or episode. Subchronic, occurring repeatedly over several weeks or months, while chronic, occurring repeatedly for many months or years. Frequency of exposure. The other time-related factor that is important in the temporal characterization of repeated exposures is the frequency of exposure. This diagram shows the relationship between elimination rate and the frequency of exposure. A chemical that produces severe effects with a single dose may produce no effect if the same total dose is given in several intervals, and this is what we are going to explain. First, we are going to illustrate some basic points about this diagram. In this diagram, the x-axis represents time, while the y-axis represents concentration. A, B, and C represent chemicals that differ in their half-lives. A represents a chemical with very slow elimination, for example, a half-life of 1 year. B represents a chemical with a rate of elimination equal to frequency of dosing, for example, 1 day, while C represents a chemical with a rate of elimination faster than the dosing frequency, for example, 5 hours. In this diagram, a theoretical toxic concentration has been assumed to be 2 units. The figure on the left-hand side shows that chemicals A, B, and C can produce toxic effects in a single dose, and we can see that the toxic concentration of 2 units has been achieved by all of them. Concerning the figure on the right-hand side, the same total dose of each chemical has been given in several intervals. For chemical B, in which the half-life for elimination is approximately equal to the dosing frequency, the toxic concentration is not reached until the 4th dose, while for chemical A, which has an elimination rate much slower than the dosing interval, the toxic concentration is reached after only 2 doses. Conversely, for chemical C, where the elimination rate is much shorter than the dosing interval, a toxic concentration at the site of toxic effect will never be reached regardless of how many doses are administered. At the end, we can say the slower the elimination rate for a chemical, the more accumulation would occur to produce toxic effects. It is possible that residual cell or tissue damage occurs with each dose even though the chemical itself is not accumulating. The important consideration then is whether the interval between doses is sufficient to allow for complete repair of tissue damage. Now we are going to determine the situations in which chronic toxic effects may occur. Chronic toxic effects may occur if the chemical accumulates in the biological system, when rate of absorption exceeds the rate of biotransformation and/or excretion. If the chemical produces irreversible toxic effects, or if there is insufficient time for the system to recover from the toxic damage within the exposure frequency interval.